Okay, so I want to thank everybody for coming tonight, for taking out a half an hour out of your life to learn something that I think is really, really important. So there's a lot of subjects that I talk on. I talk on nutrition. I talk on longevity. I talk on male and female health issues. And I talk about children's health issues. But tonight, I'm going to be talking about the main thing. What it is that really controls and coordinates all of our body's functions. The thing that we really need to understand about health. So this is called How Not to Short Circuit Your Brain, or how your body really works. So if you look at the nervous system, and I want you to understand the nervous system like a safety pin, okay? So you have the brain and you have the body, and you have loops of communication between the brain and the body. A subluxation or a misalignment of the spine putting pressure on a nerve will interfere with that, or will break that or alter that communication. So the top of the safety pin is like a brain, the bottom is like a body, and the nervous system is connecting the brain and the body. So all doctors who care for people with the primary objective to enhance life, to enhance health, understand this system and work with it. So if we look at the pathways of the brain, you have what was called the efferent pathway, which is the messages from the brain to the body, and the efferent pathway, which is the brain, the messages from the body to the brain. Now here's how this works, and this law is not privy to just chiropractors. This is just basic science. Is our body experience something? It could be something we eat, something we do, something that we're exposed to, and that sends messages to the brain. The brain then works on that and sends messages back to the body, telling our bodies how to adapt. And this is going on constantly throughout the day, constantly throughout all of our lives. It's a system, these loops of communication. The body experiences something, goes up to the brain tells the body how to react. Anyone who does not know this or respect this efferent pathway is violating one of those fundamental laws in life if they're doing this and before they administer a diagnosis. So why would that be? It's because if this is part of the problem in somebody's health, then that has to be fixed, that has to be corrected. So how important is the nerve supply from the brain to the body? We're going to look at three scenarios. Number one, bad scenario number one, the guillotine. The French developed the guillotine. When you sever the head, the body dies instantly. Why? Because the electrical supply from the brain to the body is completely severed, leaving the body devoid of all nerve signals which are vital to life. So we know that when you sever the head, you die instantly. Now you can go without food for 2 months before you die. You can go without water for maybe 7-8 days before you die. You can go without air, maybe 2 minutes, but you cannot go 1 second without nerve supply from the brain to the body. Look at bad scenario number two, a partial severing of the nerve supply of the brain to the body. Now remember Christopher Reeve. He was thrown off his horse, broke his neck right up to the top. He was paralyzed from the neck down and could barely move his hands. And, he died at an early age because of this. So much, but not all of the nerve supply was cut off with him. Let's look at bad scenario number three. Subluxations interfering with the nerve supply from the brain to the body. This is what chiropractors correct. And a subluxation causes an inflamed joint and a swollen disc. So a minor subluxation can cut off 60% of the nerve flow to an organ or a muscle. Chiropractors are trained to correct subluxations. The nervous system is the master controller of your body. Subluxations interfere with that. They interfere with how your organs function. They interfere with how everything functions in the body. So the subluxation will eventually destroy your spine if not corrected. It'll cause degenerative joint or degenerative arthritis in the spine. And I've seen this in many patients. In fact, right now, I have patients that have necks that look like this. They have to see me regularly because subluxations destroyed a lot of their spine or really damaged it. So the origins of life is triggered by what happens in the central nervous system. The brain is constantly doing its best to make endless observations to help the body maintain life, as much life as possible. There is no evidence in a healthy brain can create sickness in the body. In fact, it's usually an unhealthy body that creates sickness in the brain. And that's for, I do several talks on that. The brain is downstream from what happens in the body. So even if you had never exercise to keep your body vibrant and you eat junk food continually, junk food and energy drinks, the brain is going to continually try and adapt your body to be as healthy as possible and to help create life and help you create another breath. And when the brain cannot do that anymore, when the brain cannot help the body adapt, that's really when you die. Let's talk about how the central nervous system is formed. It starts with two cells that divide exponentially. The next thing that happens are the brain and the spinal cord are formed. The brain and the spinal cord are the first things formed in a human body. Now, does anybody know why that is? Why would the brain and the spinal cord be formed first? Any ideas? Because the brain and the spinal cord then direct the development of the rest of the human being. So the brain is formed first because it controls and coordinates the development of the child. So nerves grow off the spinal cord, organs grow off the nerves, and it's all directed by the brain. That's why when a mother is pregnant, especially in the first trimester, the baby's very sensitive to toxicity and chemicals and pharmaceuticals, because this is what's happening with that baby in the mother's womb. Now, there are times when the baby is more sensitive in the third trimester, and I've read that recently, but it's very, very important for the mother to eat as healthy as possible, to be exposed to as few pharmaceuticals and chemicals as possible, especially in the first trimester. So the body tries to protect things appropriately. So vital organs are protected by the ribs. Do you think it's a coincidence that the brain and the spinal cord are encased in bone? Bone is 9 times stronger than steel by weight, much more flexible as well. So it's no coincidence because the body is trying to protect its most important system. So let's talk about subluxations or interference in the nervous system. They've been described actually in multiple different ways, but here's 4 different ways. Number 1, this functional movement of a joint irritating a nerve. That's a very, very, I would say, functional way to describe a subluxation. When you have a joint that doesn't move right, you create inflammation, and that can create problems with the nerve. So that leads to inflammatory process of ligaments and discs and other tissues surrounding the nerves where they exit the bones. So that's another way of looking at a subluxation. Third way is outright compression of a disc, and you see this sometimes on MRIs where you have a disc pressing right on a nerve, and you can actually see that. The fourth thing is an electromagnetic charge from an inflammatory response, creating tissue changes which emit alteration in tone and electrical field. I think that there's probably some of all of this going on in a subluxation. And in fact, I think there may be even more going on than what we've ever realized or what we continue to discover. If you look at what a subluxation does and what the nervous system does, when you adjust a subluxation and you free up nerve supply, you're changing the processing in the prefrontal cortex of the brain. So the prefrontal cortex is involved with our mental health, immune system, inflammation, endocrine system, GI system, pain and stiffness, sleep, blood pressure, heart rate, attention, and focus. So this is basic research done by a woman by the name of Heidi Havoc. And she found that when somebody's adjusted, it changes the prefrontal cortex. It actually changes the way your brain works. And I've had people tell me that. They said, you know, my head cleared up. In fact, I had somebody tell me that tonight. You adjusted me, my head cleared up. It felt better. People don't feel as much brain fog. Sometimes they feel a much better sense of wellness. And so this has all been researched and published in research. Here's another thing that happens. And these are all the articles in the literature that show what I'm going to talk to you about. When you adjust somebody, it changes hand-eye coordination and proprioception, how you balance, how you move. It changes brain processing and proprioception, information from the upper and lower limb. So you actually process things better. Your hand-eye coordination changes. These are all the articles, published articles that prove that have shown that. The prefrontal cortex is like the brain's conductor, like the body's conductor. And it conducts everything that goes on in the brain and in the body. Well, chiropractic care impacts the prefrontal cortex. And this is also why chiropractic care is really, really important for children. So children that are really clumsy, chiropractic care is something that would be very, very appropriate for them. Kids that are sick a lot, kids that have inflammation, kids that have learning issues, chiropractic care, very, very important for that. In fact, I've had recently, I had somebody bring in a highly autistic child, and they were telling me how much chiropractic has helped this kid function better. The scientific evidence proves that people with this kind of dysfunction, meaning a subluxation, when adjusted, reveals a response that enhances function and decreases health issues or problems. So there's three ways to look at chiropractic. Number one, I don't believe in chiropractic. How many have heard that? Mm-hmm. Anybody? Yeah. Why do you think that is? Why do you think people don't believe in chiropractic?
Well, they've just bought into the medical profession all of their lives. So, why would chiropractic help?
Yeah, they haven't been really educated to understand how their bodies work. And our bodies, we do not get sick because of pharmaceutical deficiencies. And so they have not been educated in how our bodies work. They haven't been educated in grade school, high school, college, and the television commercials are all pharmaceutical commercials trying to tell people that what you have is a pharmaceutical deficiency. So that's part of the issue right there, is they just haven't been educated. And that's why I do these Tuesday night talks, to help people understand that. How about this one? Chiropractic is only good for pain relief. So, and I have patients like this. they primarily come in when it hurts, or they want to keep from hurting, okay? And that's a way to look at chiropractic. But really, what chiropractic is, it really enhances the way our entire bodies work, the way our entire bodies function. And I tell people this, I said, look, if you start chiropractic care early enough, there's a good chance that we can save you from a hip or knee replacement. Because chiropractic care, it enhances the nerve supply and really helps balance the weight and the gait of the body. So chiropractic care really enhances how our entire body works. That's really the message that I'm trying to get across tonight. So chiropractic care is not necessarily designed to make you instantaneously feel better. Some people do feel better instantly, okay? A lot of people don't. Why is that? Why would people not necessarily feel better instantly? Anybody?
They've been so used to feeling not normal that when you get a chiropractic adjustment and it moves things around, it would make them feel worse. It's like, well, why am I feeling like this? Because I felt fine before, or they thought they did.
And that's true. And the fact of the matter is sometimes healing takes time, and sometimes what's wrong with people can't be felt by an adjustment. For example, can you feel if you have high cholesterol? No. But people take cholesterol medication all the time and they don't feel anything. They're just trusting that the medication is working. Can you feel high blood pressure? Not all the time. Can you feel high blood sugar? Not all the time. And so chiropractic doesn't make you instantaneously feel better, but it does make you instantaneously heal better. You can start the healing process. And you may not know what's going on inside of your body that's due to the fact that you have subluxations and an altered nerve supply. So if you study the loop between the brain and the body, do you think that messages need to travel at 100%?
Yeah.
Yeah, sure they do. Okay, so a liver that's trying to detoxify, and many livers I've seen are toxic. Do you think that needs 100% of information from the brain to the body to detoxify? Absolutely it does. What about a heart? Does a heart require 100% nerve flow without interference from a subluxation to work properly? Sure it does. Of course it does. Keith Wassum, who's done a lot of videos and slides on chiropractic, stated that thinking chiropractic as only pain relief is like robbing a bank and stealing only the pens. And since they chain those pens down, they don't even want you taking those. So chiropractic is a lot more than just pain relief. So let's look at like a medical way of looking at back pain. So cortisone injections is a way that people deal with back pain. I'm not saying you should never do them, but here's what happens. If you kill enough of the nerve endings to reduce the swelling so you don't know there's a problem, you can go back to work or back to your sport and re-injure yourself even more. This used to happen back in the 60s and 70s in professional football, before they realized that these football players were damaging themselves to the point where they couldn't play anymore because they were getting enough cortisone to reduce the swelling, inflammation, and pain. They put them back out on the field, but the injury got way worse. Well, that's not the case anymore because they learned their lesson like that. So this is not health care. This is crisis intervention when you have to start injecting cortisone into joints. In fact, much of our healthcare system isn't health care. It's crisis care, symptom care, disease care. So here's an interesting article in the December 2019 Journal of Radiology. It stated the following about steroid injections into joints. It said steroid injections can accelerate osteoarthritis. They can cause subchondral insufficiency fracture, which would be this area right here. They can cause complications of osteonecrosis, is where the bone actually starts to die. And they can cause rapid joint destruction and bone loss. So steroid injections aren't always as safe as what we've been told. And they can cause some real problems. With chiropractic, the process is slower. It can be slower than a steroid shot, but is much more in tune with what your body needs to do to feel safe. If your body is giving you pain, it's for a reason. Just like when the oil light comes on in your car, it's for a reason, okay? And it's telling you that something is wrong. When you cover up the pain, it's like taking a screwdriver and punching out the oil light so you don't see it, okay? And we're not here to hide your symptoms and pretend that these afferent pathways are working okay. We're here to try to find the underlying cause of why the oil light in your body is going on. So research has shown, and this is one of the first research studies that was ever done on chiropractic. It was done while I was in the 70s when I was in chiropractic school. Shows that even a minor subluxation can shut down 60% of nerve flow. So only 10% of your nerves deal with pain. The remainder of the nerves in your body support function. So what does that tell you about pain and function in the body? If only 10% of your nerves deal with pain and the rest support function, what does that tell you? Anybody? Maybe it tells you that pain isn't a very good informative source to tell you how healthy or unhealthy you are. Because you can have no pain and a massive loss of function and not even realize it. In fact, a lot of the brain's activity during the day, and this has been shown to be true as well, is just keeping us upright and keeping us coordinated. A lot of the brain's function goes into that. And so only 10% of your nerves deal with pain. You can have no pain, but a lot of loss of function. And even if your liver is functioning at only 40%, you don't even know if something's wrong, because the organs don't necessarily give you pain when they're not functioning like they should. So an individual who has a nervous system as free of interference as possible can fight off infections or sickness much easier. So do you think during COVID, if you were being adjusted, that would either prevent you from getting COVID or at least prevent it from being as severe? Absolutely it would. Okay? I'm not saying that people that got adjusted didn't get COVID, but it wasn't as severe. One of the things I noticed about my patients is they didn't have long hospital stays. The ones that were getting adjusted during COVID, there were some that spent the night in a hospital. They were released the next day. They didn't have long stays in the hospital. They didn't have nearly as severe of COVID issues as other people that I know. So if you look at children who are subluxated may not feel pain. But what do experience are chronic colds, allergies, food intolerances, behavioral issues, ear infections, sore throats, and all which stem from interference between the brain and the body, and the body and the brain. When you clear out that interference, a lot of these issues either go away or they get a lot better. Now, some of this can come from what's being fed to the child as well. The child can have food intolerances that are causing some of that, but correcting the subluxations I found in kids can make them much, much healthier. So there's an article in a prominent neurobiology journal in 2014 that stated the following regarding the nerves in the upper part of the neck. They have a great influence on heart and lungs. They also influence the entire autonomic nervous system to influence whole body health and biological balance. And that's just this area right here. So this shows from this article, and this is not a chiropractic journal, this article shows how important it is to keep our bodies subluxation free as much as possible. So this is one reason why it's difficult to understand how chiropractic can work, because people see it as chiropractic is pain relief. You have a joint out in the back that's hurting you. What they don't understand is the effect that it can have on your body. So some people say, do you have to go back over and over to get adjusted? No, you don't have to. You can stop whenever. The problem is how healthy do you want to be? Do you want to keep your spine and nervous system healthy? That's really the question. You want to keep your spine from degenerating nearly as quickly or at all. How healthy do you want to be as you get older? I mean, we don't brush our teeth because they hurt. We brush our teeth because we want to keep them. In fact, if you wait till your teeth hurt, that's quite a bit down the road. You're going to have to go see a dentist and get some serious dental work done. So if you look at Tour de France riders, they get adjusted not just because their backs hurt, because they perform better. Racehorses get adjusted. Why? Because it enhances their performance. In fact, animals are a lot healthier and they live longer when they're adjusted. And I adjust animals regularly here in my office, and their owners tell me how much better they do, how much more energy they have, how much better they function when they're adjusted. So as doctors of chiropractic, we don't just adjust people to get people out of pain, even though that's why a lot of people come to us. We adjust them because it's the right thing to do. You drink more water because it's the right thing to do. You take supplements because it's the right thing to do. And you get adjusted because it enhances your expression of life. So my goal is not just to get you out of pain. It's to teach you to take better care of yourself, to teach you that the brain and the body requires 100% afferent pathway. And again, this is not somebody's theory or opinion. The evidence is overwhelming. A properly functioning nervous system will give us a much greater chance of being healthy as we get older. And I can tell you this from my own life. I've been getting adjusted once a week for 48 years. I'm 72, and I don't have any of the health issues that 72-year-old men have. None of them. And so it does work, and it does help. And I just went to a college homecoming, our 50th anniversary homecoming a couple weekends ago. I saw guys there that I haven't seen in 50 years, that I knew when they were 18 through 22. And there was a lot of people there that were walking. Well, there were people walking with canes, people having trouble getting up and down out of chairs. One individual that I didn't hang around with, that I didn't know very well, said to me on the way out, she says, I see my doctor more than my wife, and every time I go, he gives me another pill. You know, I don't have that issue. And what I saw there more than anything else, and just talking to people, was most of those people, I didn't hear one that went to a chiropractor, but there were a lot of people that had surgeries, that were on medication, that had all kinds of health issues. That's what I'm trying to save people from here. And I would ask this, who do you know that doesn't know what you know about chiropractic? Who do you know that just needs to get checked, that just needs to find out if chiropractic can help them? Because I want to save people from the very things that I saw down at my 50th homecoming. I want to save them from having to walk with a cane, to have them get up, have trouble getting up and down out of a chair, having trouble walking, have where they see their doctor more than their wife. I want to save people from that. And that's why I'm here, and that's why we practice. And so I want you to just think about that, and think about who you know that needs chiropractic, that needs what we offer, or that may need it, and we can just check them and get them functioning. Find out if they have subluxations, and if they do, get them functioning a lot better, and keep them healthy into older, as they get older. Keep them healthy in their 70s and 80s. So that's all I have tonight. I want you to really think about what I've talked about in terms of talking to people that you know that need that aren't healthy, that their health is going downhill, they're having problems walking, they're having problems functioning, because there's a chance that I may be able to help those people. They may have subluxations that are causing some of those issues, maybe a lot of those issues. So think about that, and you can talk to Carmen and talk to them and have them call Carmen. And we'll be glad to do a screening at our expense just to see if we can help them. If we can, we'll tell them. If not, we'll make sure we can send them someplace that they can get help. So thank you very much. Next week, or 2 weeks, we're going to be doing the talk, Understanding Alzheimer's. What causes Alzheimer's? What are the things that we can do to prevent that? We'll be doing that in a couple of weeks. So I'll see you then.